Rounding is a process whereby the staff at the commencement of each shift introduce themselves to the patient, discuss with the patient the day's plan, introduce themselves. The patient then knows their name. It then involves, as well as nurses, providing clinical care during their shifts, such as medication administration, IV antibiotics, and basic nursing needs, that they visit the patient on an hourly basis, where they then discuss with the patients, are they comfortable? Do they need to be repositioned? Do they have all the possessions that they need for that shift, such as they have their access to their call bell, do they have access to their TV control, are they able to reach their bedside table? It's also then, it's checking with the patient, have they got, do they need any assistance to sit out of bed, to walk or attend any basic hygiene needs. It also, it's about assessing the patient for pain. Do they need something for pain or other measures to assist with the patient's pain? Research shows that rounding improves patient outcomes, it improves patient satisfaction, it decreases falls, which is probably one of the major reasons we started it on the medical unit with our patient types, high risk of falls. It aids in the prevention of pressure areas. There's a rounding logs used to document the care provided on that hourly basis. By providing the hourly care, it frees up nursing staff to attend to other nursing needs where they're uninterrupted, because the patient feels quite comfortable, they feel safe, and they know the nurse will be back every hour to assess their needs. After the process was implemented, which was July 2011, we did a patient satisfaction survey, and we also did a staff survey. The feedback from the staff was very positive, as was the patient survey. Staff felt that they got a better patient nurse-patient relationship. They felt that they had some time freed up because obviously there's a decrease in call bell use for patients. Probably one of the biggest positives out of it is the decrease in patient falls. We've come to about a 40% decrease in our patient falls. Patient survey was also really positive. Patients felt a lot safer. They expressed that they felt a lot safer. They felt too that they got to know their nurse better because they were introduced at the start of the shift. Also, with the rounding, we introduced whiteboards in each patient's room where the staff member was able to write their name on the board at the commencement of the shift, so our patients all during the day could refer to that and know that was the nurse that was looking after them. They could also refer their family to the board, and if the family wanted to discuss any of the patients with the nursing staff, they could go and find the appropriate staff member. On the ward, we at the commencement of rounding, when we started it, we had regular in-services. We got together a group of the senior nurses who then educated the more junior nurses. Rounding, another positive of rounding is that when you have pool staff on the ward, or casual staff, or new staff, graduate staff, the process of rounding supports the more junior staff as you go around with the senior nurses at the commencement of the shift. So then if there's any questions, they're supported by the senior nurse. It's just much better for patient care and for staff. And the big thing is that decrease in patient falls is probably a real major win for the ward and for the patients, just that the outcomes for patient is much better having rounding.